Dr. David Samimi here, and he is from Dignity Health California Hospital, and he was helping us earlier understand the dangers of looking up. One of those little kids was cheating, and that really is not a good thing to do.
Really? Did you see that? I did not.
Yeah.
It's actually even more dangerous for kids because they're more likely to get damage. We don't know how long it takes, but it's relatively short, and you can basically just have some burns on your retina, which are half the time permanent.
Wow. That's terrible news. So right now, it's 10:43, 10:44. People have been watching. How long, if they did this wrong, if someone snuck a look or did whatever, how long before you know something's happened?
So it usually is a few hours. And the symptoms that you might have is seeing maybe flashing lights. It just looks like the center of your vision is a little bit blurry. And it can be anything from that to a severe headache. And sometimes it can even take till the next day to notice it.
Okay, so later today into tomorrow, if you think, or one of your kids or something like that, looked at the sun, you're looking for symptoms. Pay attention if they tell you they have a headache. Pay attention if they tell you their lights are flashing.
Exactly. Or that things are blurry.
Or that things are blurry. And then what should you do?
You should take your kid's head and just dunk it in a big bottle of ice water.
What?
No.
I'm just kidding. That's a joke. Don't do that.
Don't joke like that.
It's not gonna help.
So when they come in, dunk their head in ice water.
Doctor, he'll be here at 7 and 10. Try the skirt stick.
It'll cool them off.
Oh, God.
No, I mean, really, take them in to see an ophthalmologist.
Yeah.
Usually what you're going to do is they'll check the vision first so you get a baseline, because if you're within the first 4 lines of that eye chart, then you have a much higher likelihood of regaining 100% of your visions.
Prevention is the most important thing.
Prevention is the most important thing.
Okay,
we really don't have actual treatments.
If you picked up these glasses, if you're reluctant enough to find the glasses, there's a little number on the inside where you can look up and make sure it's a legit pair of glasses and not a counterfeit,
That's
right?
right, exactly.
And then you should see nothing when you look in the glasses except pitch black.
Pitch black, unless you're actually obviously looking at the sun, or you can even take your camera, the cell phone camera flash, and you put that right in front, you'll see a little dot.
Okay. All right. And
all right, but so you're saying prevention, but okay, if something happened in the meantime, you think something happened, you don't need to go to the emergency room. You need to go to the eye doctor. No, they're not going to do anything. Go to the eye doctor. I mean, ideally, if you can get to a pediatric ophthalmologist or a pediatric optometrist. It's a child.
Yeah, because it's difficult to kind of work with kids, and they need a dilated exam. You'll examine the back. You'll basically look inside the retina here, and usually you may see some discoloration on the back part where the vision is, and that discoloration usually can kind of take months to go away, and that gives you an idea that actually there is something going on objectively, because it's tough to manage with
And can I
kids.
tell you, when Liz and I ran upstairs to take a look, we were playing around with the camera and the glasses, and it's really tricky. It can actually, slip off, and in a second, it was really painful. I could feel it. It was like, put it down. Hey, look, Liz, a new shot. I think she said Casper.
Casper, Wyoming.
Wyoming.
Did you just say you looked into the sun?
When I was messing around with it, and the glass, Hal's right. It's hard to keep the eyeglass portion on the little camera, and just as I was moving, it sort of slipped away. So be careful.
Good points. Excellent points.
Use the real thing. If you
Dr.
can.
David Samimi, thank you very much
Hey, thanks.
Thank
for
you for
coming in,
Yeah,
Dignity Health.
warning us and telling us what to do. We appreciate that very much. Hey, be careful.